The health concern that is drawn from both our resources is the growing use of cannabis within Canadian youth. The high rate of cannabis use can be described as worrisome as it can be linked to several negative health effects. This topic should be taken seriously by healthcare professionals as social justice advocacy is an expectation from all, especially nurses. Using an upstream approach to combat the cannabis crisis has been proven most effective. Healthcare providers are encouraged to regularly ask all youth patients about cannabis use, implementing evidence-based prevention and treatment programs. This is becoming more important with the increased use of social media within adolescents. With the influence of the media industry on the rise, healthcare professionals need to use their positions to advocate for the vulnerable young population by actively working to change drug policies. They can use their individual voices to persuade policymakers or encourage organizations to speak on their behalf. Nurses often create strong patient bonds and should use this as a tool to provide a safe and open space for honest communication between them and their adolescent patients. To conclude, nurses should find importance in this topic as the continuing intervention of cannabis use will help prevent the lifelong consequences in adolescence.
Now we're going to give a short overview of our articles. Our first article, called Cannabis in Canadian Youth, found that Canadian adolescents have the highest cannabis use among 29 of the world's most advanced countries. This is quite concerning since recent evidence points to substantial risks associated with regular cannabis use. This includes an increased risk of developing cannabis addictions and social dysfunction, including work and school impairment. One thing this article points out is that strict cannabis enforcement policies are not a deterrent for adolescents. Studies show that countries with less strict drug laws had lower rates of cannabis use by teens than Canada. Not only do strict policies not help, but they have serious consequences such as human rights violations, waste of public resources, and stigmatization of drug users. Health professionals as advocates for the vulnerable young population should be working with law and policymakers to speak on the behalf of adolescents. Drug policy should be based on evidence and not ideology. Our second article talks about legalization of recreational marijuana and how messaging from websites and other social media outlets are shaping product perceptions and use. The messaging is appealing as it includes color and interesting packaging. Findings suggest that there is need for increased regulation of social media messaging and marketing of marijuana, with a special focus on social media influencers and marketing that targets teenagers and young adults.
Carly Weeks, a health reporter for the Globe and Mail, wrote an article on how clinicians should ask adolescents about their cannabis use. Throughout the article, Weeks provided statements from clinicians such as Christina Grant, co-chair of the Canadian Pediatric Society, and Karen Leslie, an adolescent medicine physician. Both clinicians provide insight on what appointments should look like when following discussion guidelines. For instance, both paint the image on how clinicians should routinely ask adolescents about their cannabis use at every appointment. Furthermore, Weeks provided facts on the number of teenagers who had tried marijuana, which is about 44% of 16 to 19-year-olds in Canada. In addition, 1 in 6 adolescents who use marijuana will go on to develop mental or physical problems. Together, by providing the insights of clinicians on how appointments should look like and the reality of teenagers who do use marijuana, it raises concern and awareness of this health issue. Furthermore, it ultimately allows viewers to understand this health concern through a phenomenological lens. As we recall, a phenomenological approach is all about understanding the meaning of lived experience. This experience includes the nurse-client experience, the way practice is being done by the provider, and ultimately the client's health and healing. All aspects of the phenomenological approach are addressed in this article. For instance, Dr. Leslie paints the image of every appointment involving respectful conversations about cannabis and informing patients on how it may have an effect on all facets of a patient's life. Not only does this give insight on the way of practice, but it also demonstrates the nurse-client experience, particularly on how the healthcare providers act as a confidant and healer to adolescents. However, what this article does lack is the perspective of the adolescents. Weeks does not provide experiences, especially during appointments, from adolescents on this topic. From a healthcare provider perspective, we see the importance of discussion to help healing and to enhance the quality of care. However, can we say the same for the patient's point of view? Do they too see the importance of discussion for their benefit? We can't say for sure as we don't have the accounts of their experiences to reinforce this idea. Although Weeks does provide elements to present this topic of marijuana use amongst teenagers via a phenomenological lens, she fails to emphasize the importance of this topic. The article should have provided statements from adolescents to fully paint the nurse-client experience.
The social pressure to smoke can be influenced by parents and peers, but social media has the highest influence, leading to the use of various products. The ads for marijuana and tobacco are widespread on social media platforms and are not regulated properly, creating a risk factor for adolescents. These ads show the emotional and personal benefits, but ignore the health risks. The spread of these ads can be direct or indirect, direct meaning it's coming from a company, and indirect meaning it's in a video or a picture, such as memes. Social media can promote these products, showing they are highly acceptable. There are three major themes that influence usage on social media. The tools and the design of social media platforms can help to promote smoking. Examples include Facebook showing ads from tobacco companies when the user is not following the company, and pictures on Instagram are easily accessed since users don't actually have to follow that account. This causes these media platforms to be used as a place to sell and promote marijuana products. Sharing of this info is also very easy through commenting, tagging, and direct messaging, which also provides additional privacy. The way these products are also advertised are known to spark interest in adolescents. It is shown that pictures with many colors and few words create imagery, making the product more memorable, which increases sales. Products are also displayed in humorous ways and are shown to increase sexual appeal when the product is used. These techniques are used to grab adolescents' attention, creating a positive image of these products. The source of these messages also influence the use of products. It is shown that adolescents would trust peers rather than the industry since they have used the product. Some celebrities showcase their lifestyle with tobacco or marijuana products, creating a positive image. Additionally, adolescents would like to see the ads so they can make their own choice of whether or not to use the product, thinking that this exposure to pro-usage will not influence their decision, but they do. In all, there is little to no regulation of smoking products on social media, but there needs to be since adolescent teens are the main users, and the real effects of these products need to be shown properly.
Everyone in every health center across the globe is responsible to ask teenagers whether they smoke anything or not. Why? Well, smoking, especially marijuana, is related to anxiety, depression, and some other mental illnesses. Most investigations have discovered that short intercessions are successful in decreasing substance use, incorporating cannabis use in youth. Nonetheless, one ongoing randomized investigation of 65 cannabis-utilizing youth found no improvement in results after a concise intercession. Therefore, healthcare providers in essential consideration ought to consistently get some information about cannabis use and offer data on the increased danger of damages from cannabis for youth clients. Nurses and doctors ought to be set up to give brief intercessions just as to offer references to compulsion administration to all customary cannabis clients who can't scale back or stop. They should likewise give herd decrease data on cannabis use to all adolescent patients.